How is an ovarian cyst diagnosed? Your healthcare provider will first rule out pregnancy as the cause of your symptoms. Then, they may use the following tests to diagnose an ovarian cyst. A pelvic exam. Your provider will feel inside your pelvis for any lumps or changes. Ultrasound imaging creates images of your body's internal organs by using sound waves. It can detect cysts on your ovaries, as well as their location and whether they are mostly fluid or solid. Laparoscopy. This is a surgical procedure that takes place in an operating room. Through an incision, cut, in your abdomen, your provider inserts a camera to view your reproductive organs and pelvic cavity. If your provider detects a cyst at this time, it can be removed. How is an ovarian cyst treated? Treatment will depend on factors like your age, your symptoms, and what's likely causing your cyst. Watchful waiting. Functional ovarian cysts usually resolve on their own. If your cyst is likely functional, your provider may suggest a wait-and-see approach. A few weeks or months after your diagnosis, you may have a follow-up ultrasound to see if your cyst has resolved on its own. Medications for ovarian cysts. Your doctor may prescribe hormone-containing medications, such as birth control pills, to stop ovulation and prevent future cyst formation. Ovarian cyst surgery. If a cyst is causing symptoms and growing in size, it may require surgery to be removed. The type of surgery is determined by the size of the cyst and its appearance on an ultrasound. Among the various procedures used are laparoscopy. This is a procedure in which your provider inserts a small camera into your abdomen through a small incision. They use the device to examine your reproductive organs and pelvic cavity. The ovarian cyst can be removed using small incisions, ovarian cystectomy. Laparotomy. Your provider may perform this procedure if the cyst is very large or if there are other concerns. Can ovarian cysts be prevented? Taking hormone-containing medications, such as birth control pills, will prevent ovulation. According to some studies, the pill reduces the recurrence of certain cysts. Ovarian cysts are usually harmless enough that prevention is unnecessary. Instead, make a note of any symptoms that may indicate a cyst and notify your provider. Schedule regular pelvic exams so your provider can detect any cysts that need to be treated. What can I expect if I have an ovarian cyst? The majority of cysts are functional and will likely disappear within a few months. Follow-up imaging may be required to ensure that a cyst is not growing. If your provider notices a cyst that could cause complications in the future, listen to their advice carefully. Your doctor may advise you to wait it out, prescribe medication, or a combination of the two. Surgery may be required for more serious cysts.